What are the risks of bile duct surgery and how to avoid them? Bile duct surgery is a complex procedure used to treat blockages, stones, or cancers affecting the bile ducts. While these surgeries are often successful, they do carry certain risks that patients and doctors need to understand. Knowing these risks helps in making informed decisions and preparing for the best possible outcomes. One of the most common risks with any surgery is bleeding. During bile duct procedures, blood vessels can be injured, leading to bleeding that may require additional treatment. Allergic reactions to anesthesia or medications used during surgery are also possible, though rare. Wound infections can develop after the operation, especially if proper care is not taken. Blood clots, known as thromboembolic events, can form in the legs or lungs, which can be serious but are preventable with proper precautions. These general risks highlight the importance of thorough preoperative assessment and careful postoperative monitoring. Specific risks are associated with particular types of bile duct surgeries. For example, in a procedure called cholecystectomy, where the gallbladder is removed, injury to the bile duct is a serious concern. Such injuries can lead to bile leaking into the abdomen, which may cause pain, infection, or requiring further surgery. Sometimes gallstones remain in the bile ducts after surgery, causing symptoms like jaundice or pain and needing additional treatment. There is also a small chance of injury to nearby organs like the intestines or blood vessels during the operation. Endoscopic procedures like endoscopic retrograde cholangiopancreatography are used to diagnose and treat bile duct problems. While helpful, ERCP carries its own risks. Pancreatitis, or inflammation of the pancreas, occurs in about 3 to 5% of cases, caused by pressure or irritation during the procedure. Bleeding, infection, or perforation of the small intestine can also happen, but these are less common. When surgeons explore the bile ducts directly, risks include bile leakage after tubes are removed, infection around drainage sites, or stones reforming in the ducts. Narrowing of the bile ducts can develop over time, which might require future interventions. After gallbladder removal, some patients experience persistent symptoms like nausea, indigestion, or abdominal pain. This is called post-cholecystectomy syndrome and usually improves but sometimes needs further management. In cases where bile duct injury occurs, outcomes depend heavily on how quickly it is diagnosed and treated. If managed promptly, many patients recover well, but severe injuries can lead to long-term problems like bile duct narrowing or infections. In liver transplant patients, complications like leaks or narrowing of the bile ducts happen in about 15 to 20 out of every 100 cases. Sometimes, blood supply issues cause damage to the bile ducts, which might require additional surgeries or procedures. So, how can these risks be minimized? The most important factor is choosing a surgeon with extensive experience in bile duct surgeries. Procedures should ideally be performed at specialized centers with teams skilled in managing complex biliary problems. Proper preoperative assessment is crucial. Doctors evaluate factors like age, overall health, and anatomy to identify patients at higher risk. Advanced imaging techniques such as cholangiography help map the bile ducts before surgery, reducing the chance of accidental injury. Timing also matters. In some cases, delaying repair or intervention can lead to better outcomes, especially when injuries are identified after initial surgery. Postoperative care is equally vital. Close monitoring allows early detection of complications like infection or bile leaks. Patients should report persistent symptoms promptly so they can receive appropriate treatment. For liver transplant patients, understanding the anatomy of the bile ducts and using techniques like hepaticogynostomy can help prevent some complications. In the context of liver health and cancer, bile duct surgery often plays a role in treating cholangiocarcinoma or relieving biliary obstructions caused by tumors. Because many of these patients have underlying liver conditions, such as cirrhosis, their risk of complications can be higher. That's why specialized surgical teams and careful planning are essential to ensure safety and success. In summary, Bile duct surgery does carry risks, but with experienced surgeons, thorough planning, and careful postoperative care, most patients can have positive outcomes. Always discuss your individual health situation with your healthcare team and ensure procedures are done at centers with proven expertise in complex biliary surgery. Remember, personalized medical advice from your doctor is the best way to navigate these procedures safely.